Hey everyone, I'm Jumin and I'm really happy for my aunt that she had a great outcome after breast cancer surgery. I think it was because of a good decision she made, so I thought that I would share it here so that if anyone might encounter a similar difficult situation, they can perhaps discuss this approach with their doctor. Please note I'm just sharing a personal experience. It may or may not apply in your case, but because of my aunt's great experience, I would like other women to know about this and to ask her surgeon whether she is suitable. Certainly, if I were to get breast cancer, I would want to have similar treatment and hopefully the same outcome as my aunt's. So, Aunt Sue had stage 1 invasive breast cancer. She was diagnosed at age 47, and the cancer was 1.8 centimeters in size, of the luminal A type. She did not have any serious prior medical conditions and no family history of breast cancer. The first surgeon she saw advised her to chop them both off. I supposed he meant removing both her breasts through a double mastectomy. She had considered it because, firstly, many people have shared about double mastectomy online, and secondly, the cancer was close to the edge of the areola, which is the pigmented area around the nipple. And the first surgeon said that even if she were to undergo breast conservation treatment, the central part of her breast would be so distorted after surgery, it would not be worth saving. While it is true that there are many posts online about patients' experience about mastectomy and double mastectomy, my aunt was not so sure if this was the choice she wanted. So she sought a second opinion. The other surgeon she consulted told her that she could undergo breast conservation treatment. This procedure involves removing her cancer with a rim of normal breast tissue all around it while preserving the healthy parts of the breast. Surgery would be followed by radiotherapy and medical treatment. She chose to do breast-conserving surgery. Surgery happened about 7 years ago. What I wish to share here is what my aunt's surgery result looks like now, which she kindly allowed me to photograph. In order to try to make the picture available to as many people as possible, I actually tried to alter it a little, but found that the scar healed so well that I could not see the scar on the modified picture. So this was what my aunt looked like with modesty spots applied to broaden availability to audience. Can you identify the scars? I could hardly see the scars on the modified photograph, so I asked my aunt's permission to show the actual picture, but with modesty spots on so that I would not get a strike from YouTube. Here is the actual photograph taken. In case it is not evident, the surgical scar to the breast is indicated by the light arrow, while the scar for the sentinel lymph node biopsy is indicated by the dark arrow. Since her surgery, Aunt Sue has been well, and she's living a full life. She tells me that she sometimes forgets that she had had breast cancer surgery because her body looks normal and she returned to her usual life about a week or two after her operation 7 years ago. Yes, she still needs follow-up yearly, and she often has to be reminded to attend her doctor's appointment. Still, she continues to have a meaningful life in her survivorship. I hope all women with breast cancer can have the same experience as Aunt Sue. Wishing you the very best of health. Take care.